Now, some scientists in Africa have expressed concern over the rapid surge in COVID-19 cases and deaths on the continent. It comes on the backdrop of the World Health Organization announcing that the steep increase in Africa is especially worrying because it's the region with the least access to vaccines, diagnostics and oxygen. According to the Africa Centers for Disease Control and Prevention, the number of confirmed COVID-19 cases in the continent have reached just over 5 million. For more on this, we're joined by Deputy Director at the Africa Health Institute, Professor Thumbi Ndung'u. Good evening, Prof Ndung'u, and thank you so much for your time. Firstly, when we look at the concerns that are being raised here when it comes to increasing numbers of COVID-19 cases in the continent, what do those figures currently look like? And is it a situation as what we're seeing in South Africa, where we're having different waves, and some of the waves, at least if it's the third wave, are much worse than what has previously been there?
Well, thank you very much, Cathy, for having me on the show, and good evening to the viewers. Yes, I think the third wave is happening here in South Africa has been experienced in some form or another in a lot of other African countries. There was a recent surge of cases in Kenya. The numbers there seem now to have gone down significantly. But in neighboring Uganda, we have an ongoing third wave of infections, where now again they have very high numbers of infections. In fact, the country has gone pretty much into a total lockdown. So I think that what we are seeing in South Africa is being repeated all over the continent. And I think what it tells us is that unless we have a permanent solution in the form of a vaccine, we are going to continue to have this ongoing problems where the cases go up, then they come down when certain measures are taken to curb the spread. But because of the fact that these measures are not the optimal solution, the most efficient solution, which would be a vaccine, we are going to continue to see this ebb and flow of cases around the continent.
One of the difficulties, of course, that makes the situation for the continent a lot more difficult is the issue of resources. The fact that already we have countries that are cash-strapped, and this concern has also been expressed by the World Health Organization.
Absolutely, Cathy. I think we are in the unfortunate position as African countries that we have a high burden of infectious disease, and yet we have the least resources of all the regions to combat these infectious diseases. And so what you're seeing is that, in fact, in the beginning of this pandemic, is what we saw is that Africa was lucky to escape the brunt of the number of infections, given the fact that we had lower numbers of cases, perhaps due to the fact that of demographic reasons. Our population is much younger, and we know that COVID affects older people much more severely. Perhaps also the fact that we are in warmer climates also helped us. But other countries have not been able to control. If you look at the United States, which was also very hard hit, it has been able to effectively control the pandemic because of vaccines. Unfortunately, we don't have access to these vaccines. So the unavailability of resources is definitely going to be something that continues to hamper the continent. And this is why the plea by the WHO and by other organizations that these vaccines be made available to African countries and other resource-poor countries is so important.
We're not seeing much progress in that regard, and one can even just look at some of the interventions that have been announced recently, whether it's the manufacturing hub that's going to be set up in South Africa. Things like that are only going to produce results a year, perhaps even 2 years from now. But in the medium term, in the present and medium term, we don't have clear solutions for how we're going to get more vaccines onto the continent. And the COVAX program seems to have been a complete failure right now.
Cathy, I think the movement that you see in terms of manufacturing capacity, vaccine manufacturing capacity, is only going to yield results into the future. For the current epidemic, we know what the solution is. The vaccines have been developed, and the vaccines are there and ready to deploy. Unfortunately, the rich countries of the world have decided to either accumulate these vaccines or in fact start targeting these vaccines to that demographic within their own populations that doesn't urgently require these vaccines. So for example, younger people who we know don't get severe disease. And yet these countries are prioritizing this demographic now for vaccination. So what we need is a rethink and global leadership here where the vaccines are channeled to the countries that they need them the most and to the areas of the world where they are most needed, for the populations where they are most needed. That's the immediate solution that I see. These are the solution of a manufacturing hub and our own research and development capability. Those are all very good things to think about, but those are for the future. For the current pandemic and the current situation, what we need is the availability of these vaccines. Beyond that is for us as citizens to take very seriously the whole responsibility of social distancing, wearing masks, the non-pharmaceutical interventions.
Sure.
But we need global leadership to be able to get access to vaccines immediately.
Professor Thumbi Ndung'u is the Deputy Director at the Africa Health Institute.